thanks to COVID vaccination and sensible behaviors from everyone, we've all been able to enjoy much better learning and teaching experience than this time last year. Moving forward, in order to ensure that all of us have as close to normal university lives as possible, I would like to make a few suggestions. Firstly, please do have your COVID jabs if you have not had them yet. It is the most effective means to safeguard our health and that of our friends and families. Also, when you are indoor, whether you are on the campus or in student hall, try to improve the ventilation by opening windows and doors. I know with colder weather approaching, one may hesitate to do so, but it is an incredibly useful means to reduce the risk of transmission of COVID and other respiratory infections. Another thing that would help protecting everyone is to have lateral flow tests regularly. If it's positive, get it confirmed by PCR, but in the meantime, please do isolate to protect others. And if you have COVID-like symptoms, you have to isolate and get a PCR test. Finally, mask wearing. I have some sympathy with those who question if it's still needed. The government has not mandated it, and when we travel in public transport or when we're in shops, most people do not seem to be wearing masks now. However, I would urge you to continue to do so this winter when you're indoors with others. There are several good reasons for doing so. First and foremost is that it is effective in reducing the risk of COVID and probably other viral infections like influenza, especially if more people wear them. At your ages, COVID infections seldom lead to deaths, but they can be quite uncomfortable and may lead to long COVID. Reinfections also occur even if one has caught it previously. Those most of you are vaccinated, unfortunately, that they do not remove completely the risk of COVID infection or onward transmission if you get infected. In our university community, there are a number of students and staff members who, despite vaccination, remain at risk of serious COVID because of their impaired immunity. They are a minority, but as caring people, we would wish to do what we can to protect them from getting nasty infections as they try to return to campus to study or work. In addition to being protective for the wearer, mask wearing is a great symbol for social solidarity and altruism. From a societal perspective, one can perhaps compare masks to seat belt. The level of lifetime benefit to most individuals is not very high, but if everyone in the UK should stop wearing seat belt, there may well be thousands more deaths on the road every year. The mortality rate from COVID in the UK is still 2 to 3 times higher than most European countries. Mask wearing is something we can all do to help reducing this number. So to summarize, jabs, opening windows, lateral flow test, and masks. Thank you for watching this.